Hey everybody, Dr. Rob Silverman here, Amazon bestselling author of Inside Out Health. Happy to share some insights on how the gut will affect mental health. A lot of people have reached out to me. It is Mental Health Month, Mental Health Awareness Month, and a lot of people wanted me to be able to share some insights with you. As you all know, I treat the gut a lot. I really look at the gut as the epicenter of everybody's health, and I do believe the gut has a direct correlation with mental health and mood, anxiety, depression, and even neurological or neurodegenerative diseases. So I'm going to be covering that, how they're communicating with each other, the gut and the brain, and the brain and the gut. I'm going to speak on some new ideas on how to help yourself have a better communication. If somebody's searching out somebody because they're suffering from anxiety, stress, depression, some of the docs or the more non-traditional docs may come into fold with some of the things I'm going to share with you. And let's dig in right now and let's talk about the gut's effect on mental health. Number one, the gut-to-brain axis. The gut and the brain communicate with each other in a millisecond. Whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. They're bi-directional, and they're able to communicate with each other through a multitude of methods. Now, what's most interesting about the gut-to-brain axis is that most people don't really realize that there's this communication. So if you eat something that's bad for you, if you had some sugar, well, think about eating like some sugar, a candy bar. Wouldn't you notice a change in your behavior? Wouldn't you notice a change in your personality? How about eating like a whole pizza pie? I mean, everybody's done a Domino's pizza at some point in their life. You feel bloated and you get tired and your brain gets lethargic. So people don't realize that their gut has a direct effect on their brain. And some other terms I've heard before is you have a gut feeling and, you feel sick to your stomach, yet your brain doesn't work that well. So some of the questions that I ask people to see if they have any gut problems are very simply, do you get gas and bloating after eating? 60% of Americans have some digestion issue, so they get gas and bloating. 45 minutes after you eat, approximately, do you feel lethargic? Do you get a brain fog? Well, if you're getting a brain fog and you're getting gas and bloating, your gut and your brain are communicating and you're not optimizing your overall performance every day. So some of the things that you're looking at in your gut are things called dysbiosis, unleveling of good and bad bacteria, 85% good bacteria to 15% bad bacteria. So most people think dysbiosis means that, I just have a little bad bacteria. Well, it is just a little is an issue, that unleveling. So dysbiosis, inflammation in the gut have been linked to mental illness, including anxiety and depression. So that gut-brain connection, getting to the root cause of the broken brain, it may be examining, may be treating the gut. It may not just be here, it's from here to here. And I want to make that crystal clear. So when we look at the gut to the brain, let's look at the idea of this 400 times the amount of messages from the gut to the brain than the brain to the rest of the body. So if you would look at it as an elevator, the elevator goes up a lot more than the elevator comes down. There's over 1,000 species of bacteria in your gut. Your gut houses about biomass, slightly over 3 pounds of bacteria in your gut. You have trillions of bacteria in your gut. There's 20 million bacterial genes in your gut, yet there's only 2,000 genes in a human. There's more bacteria than cells in your body. And here's what's most interesting. Your gut contains more neurotransmitters than your brain. 93% of serotonin comes from your gut and goes to your brain. So what's the purpose of your gut? It's to produce vitamins, digest food. It's to digest small digestible food particles. It helps you regulate hormones. It excretes toxins. It produces healing compounds. So if you want to treat the brain, you want to make that impact on mental health and some personality changes, you must remove the cause of inflammation, such as what we call a leaky gut. Now, leaky gut refers to the idea that your gut is too permeable. Your gut is supposed to be semi-permeable. Once again, it always allows a few things to pass through it. We've heard this before. Small, digestible food particles, vitamins, and nutrients. If it becomes too permeable, if it becomes leaky, if you will, if the filters becomes too big and things can pass, some bacteria, some viruses will pass. But what will typically pass is a larger undigested food particle that was on transport from the small intestine to the large intestine to be eliminated. That large undigested food particle will start to signal to the immune system inflammation. So now you'll have a localized inflammatory issue, a systemic inflammatory issue, and you'll get signals to your brain of inflammation. Brain does not like inflammation. The brain does not like signals of pain. The brain starts to shut down all bodily systems because of this. So you want to try and avoid this at all costs. So the gut's effect on mental health. Once again, let's talk about something for me that I think is a key element, and that's the vagus nerve. The vagus nerve connects the gut to brain axis. The vagus nerve is a cranial nerve, so obviously it starts in the brain or the brain stem. It actually goes from the brain stem or the medulla oblongata down through the transverse colon. Cranial nerve number 10, its name in Latin, they named it the great wanderer or the meandering nerve. It goes all the way through your upper body. It attaches to the outside of your transverse colon. And by it attaching to the outside of your transverse colon, it has the ability to sense what's going on inside your gut. Because it senses what's going on inside your gut, meaning your bacteria, your microbiota, it's able to communicate with your brain like a nerve impulse really quick. So the key to the communication or proper communication is your vagus nerve and appropriate vagus nerve tone. Your gut bacteria actually talks to your brain. Some of the things that the vagus nerve can do, or I should say, some of the things that impairs the vagus nerve is if you're too sympathetic. So if you're excited, if you're injury, if you're a little wound up. So initial stress, if you will, actually decreases vagus nerve tone and doesn't allow the gut and the brain to communicate appropriately. Something also, fiber is a great thing to help your gut and brain communicate. Fiber makes what we call short-chain fatty acids. To me, the gold medal winner of a short-chain fatty acid is butyrate. Short-chain fatty acids are great for digestion. Butyrate is a great source of fuel for cells for your gut lining. That gut lining is in its pristine condition, better communication between the gut and the brain. Once again, if somebody has dysbiosis, we talked about that before, we'll have a large number of opportunistic microbes that can proliferate in the gut, leading you towards inflammation. Again, poor gut-brain communication. People will feel depression, anxiety, and the like. I was walking around New York City with my wife this weekend, and when you walk around in the city, Manhattan most predominantly, there are people, unfortunately, in the street, and they scream, they talk to you, they have outbursts, and you really begin to understand that it's not their issue. Could be simply that their microbiome's unleveled. It's not necessarily that it's just here, it's here coming up. So what would support good mental health? Well, probiotics, a good quality probiotics. And I can see blowing up. A lot of people are going to have questions on probiotics. But there's a new term out there, and I want to share this with everybody. The literature is growing. It's burgeoning on this. Psychobiotics. And Nate speaks to the idea of the effects of probiotics in mental health. Research shows that like a Lactobacillus acidophilus bacteria probiotic improves stress, resilience, and anxiety. Many probiotics help people who are suffering from depression at this point. Gut microbes, good quality gut, having a good ecosystem, actually regulate and allow for what we call happy hormones. Short-chain fatty acids, which we talked about before, communicate with cells, which actually produce serotonin. Serotonin is a fabulous neurotransmitter that enables you to have a regulation of mood and anxiety. And another neurotransmitter that sometimes gets overlooked in the conversation is GABA. GABA regulates and improves mood. GABA is great in that it calms the nervous system. Probiotics, good quality probiotics, actually allow bacteria to produce GABA. There was a study back in 2017 that talked about actually the gut microbes and good quality gut microbes. As you evolve from IBS or irritable bowel syndrome, these microbes actually allowed you to shape the brain and allow different chemicals to be produced by the brain. So again, the data is growing. So let's look at the mechanistic effects of probiotics, if you will, on the brain. Number one, the endocrine system. So there's different hormones that you can have that are expressed that can either be negative or positive. The immune system, believe it or not, the gut produces a lot of cytokines. Now, we all have heard about cytokines through COVID-19, the cytokine storm. So cytokines are very interesting in that if the gut's producing cytokines, there's inflammation, and this inflammation can damage the brain. Neurochemical, we're talking like we spoke before, GABA, serotonin, and believe it or not, for brain overall functioning or neuronal firing, something called BDNF. Brain-derived neurotrophic factors. BDNF is produced in the gut, goes to the brain. It's a great thing to allow for brain neurogenesis. If the nerves are able to fire together, they'll be wired together. And of course, the neural system that I kind of emphasized a little bit, the vagus nerve, another great choice. And lastly, metabolic short-chain fatty acids. So some other people had sent some questions, which I wanted to address. I will answer all your questions so I can see them popping up. I'm going to answer them before we leave. People talked about gut's effect on some neurodegenerative disease like Alzheimer's. So Alzheimer's has a direct link to gut dysbiosis. It also has a direct link if we've got something called endotoxemia, the expression of something called LPS that comes out and allows for systemic inflammation. So with all that being said, bacteria does influence systemic inflammation. It can actually alter the gut and what we call your blood-brain barrier. Your blood-brain barrier is your single-layer epithelial cell that protects your brain. It actually filters 400 miles of blood vessels. 2/3 of the blood vessels in your body are actually go through your brain. And when it passes your blood-brain barrier, I kind of call it like the bouncer or the gatekeeper to your brain. So essentially, you can get this kind of invasion in there. You get increased central nervous system issues. Central nervous system is part of your brain, or I should say your central nervous system encompasses your brain and your spine. Ultimately, your gut communicating to your brain in an adverse effect or an adverse way can lead you down a path of Alzheimer's. So gut dysbiosis does lead you to Alzheimer's. Parkinson's disease, interestingly enough, 46% of people that have Parkinson's disease actually have SIBO, small intestinal bacterial overgrowth. About 50% of people with Parkinson's have some sort of gut issue. The gut in the brain, being that bidirectional communication, issues with the gut can increase your incidence of Parkinson's disease, all neurodegenerative disease. And something that I speak a lot about in my office, the role of the gut or the gut microbiome in autism. The gut microbiome is without question associated with autism. The gut can alter your immune system and your metabolism, as we've talked about. The more permeable your gut is, the higher antigenic load, more pathogens pass through your GI tract. Lipopolysaccharide, that endotoxin we talked about, has shown to have an increase in children that have autism. So the less diverse your gut microbiome is, the higher chance you have of ASD. Candida also leads you down a path of having an ASD, autism spectrum disorder. There was a study that came out in September of 2020 that spoke to the idea of probiotics offering benefits for autistic kids. It showed that these three probiotics, believe it or not, bifidobacterium, lactobacillus, and bacillus subtilis, showed reduction on scores on measures of severity in autistic children without GI symptoms. So for autistic children with GI symptoms, the probiotic was associated with improvements in GI symptoms, adaptive functioning, and sensory profiles. So a probiotic is a great choice. So let me see. I got a whole bunch of questions over here. And let's dig in. Hopefully everybody's enjoying so far this particular topic. Shanae, thank you so much. You're loving this one. I appreciate that. So I'm going to pop them up. I appreciate that you enjoy this. I think the gut plays a role. Like I said, it's the epicenter in our health. Can't speak about it enough. Next week's conversation is the gut's role in post-COVID. So we're going to talk about that. Mia, I appreciate you giving me the thumbs up. Great question. How do I feel about adding kombucha? I love kombucha. My issue with most people in most purchasing of kombuchas is that some of the kombucha now comes with a lot of sugar. If you're talking about pure kombucha, fabulous prebiotic that has probiotics. Incidentally, we've talked about probiotics, but you also have to have a prebiotic to go with your probiotic. Your pre feeds your probiotic. Your probiotic allows you to have what we call a postbiotic. Postbiotic is sort of the tombstone, if you will. It's what's left that's functioning in your gut. So your gut's an interesting ecosystem. There's bacteria in there, there's viruses, there's fungi, there's parasites, and you need a nice combination, like a neighborhood, to actually have a good quality ecosystem, because your gut has all these signaling pathways. We talked about that before. So to segue back to the question, I'm big on kombucha. I think it's a great choice. I just don't want any kombucha with added sugar. Next question. Oops, excuse me. I heard the probiotic needs to be taken 3 times a day. I don't agree with that. I take my probiotic once a day, so you don't have to take it 3 times a day. The real question about a probiotic, which is really interesting, is that, you can take the probiotic with or without a meal. And if I got 10 nutritionists, 10 scientists, 10 functional medicine practitioners, and put them in a room, 5 would say before the meal and 5 would say after. I would go, as a personal preference, right after the meal. But you don't have to take it 3 times a day. You may want to take it multiple times during the day if you're post antibiotics. And that leads me to this particular salient point. If you're taking antibiotics, you take it, you have to, go for it. If you're taking it prophylactically, I'm not really, I don't necessarily think that is a great idea. Antibiotics kill all your bacteria. It'll wreck your gut bacteria for up to a year. You'll be on some specific supplements to help you. So antibiotics, really bad for your gut. Non-steroid anti-inflammatories, the things you can take every day, Aleve, Advil, ibuprofen, really bad for your gut. PPIs, another thing that can unsettle your gut without question. So these 3 things are things that I would recommend you guys avoiding. Trying to hit all the questions. Got a lot of great questions. Would you like to hear about what L-glutamine does for healing the gut lining? Well, let's try this. L-glutamine is essential, but by the same token, is probably the most overrated thing I've heard. In that, even though 50% of it's 50% of your amino acids floating around in your blood, it's a great gut mucosal lining healer. Everybody thinks glutamine is enough, and that's it. It is not. You need a plethora of different nutrients to help with the microenvironment in your gut, to be anti-inflammatory, and also to heal the mucosal lining. So L-glutamine is great. It's probably in everybody's formulas. But if it's the only thing you're taking, it is without question not enough. So your gut's bad bacteria can really screw you up. Absolutely. And people don't realize that one meal can set you back weeks. Bacteria is very transient. It stays in your gut or lives in your gut anywhere between 11 and 30 days. So I'm a big believer in a couple of questions I like to ask everybody. What have you done for your guts lately? Do you have the guts to be healthy? You should be worried about your gut health. Everybody would look at their skin and understand if they had a hole or a cut in their skin, they would put a Band-Aid on it, because you could see it and you understand you want things to come out and things to go in. The same thing can happen every day with your gut, but you don't see it. And the only way you're going to know about it, if you're not tested, is your symptomology. Gas and bloating, lethargy, things of that nature, problems with digestion. I don't want those foods. Those foods seem to upset me. That would be a sign that you're having trouble with digestion and possibly with your gut lining. Okay. Hey, Paul, that was a great question. Thank you so much. In my deepest, darkest depression, after being on different medications, I knew I had to heal from the inside out. I've been off medication for a year. That's great to hear. And now you're healing your gut. And that is what we hear every day in the office. And that's what we hear with so many from our colleagues. They're over-medicated. They're seeking out medicines. There's too many over-the-counter things that they choose. Medicine has its place. But to use it every day prophylactically without trying to fix your own body barriers, your own body systems, doesn't make sense to me. Shanae found one without sugar, kombucha. That's great. Oh, thanks a lot. I'm happy you find this so interesting. I really do. There's more to come. We're going to advertise more and let people know that the time and the days that we're going to do it. We'll try and be a little consistent. We always used to do it Monday. Monday was a good start of the week, but it seems like everybody that's back at work now, we may go to Tuesdays at 1:00. What time of the day do you take it? I like to take my probiotics right after breakfast in the morning. So it's first thing I eat breakfast between 6 and 7. And then I would add that I'm a big proponent of taking the probiotic in the morning. I don't have a problem if you need extra doses to divide the doses through the day. But what I found is that I take it twice a day. I'm very happy if patients take their supplements once a day because people forget the evening. Myself, I have it set up so it's part of my everyday routine. So just to review, your gut is the epicenter of your health. Every time I speak, I'll remind you of that. Do you have the guts to be healthy? What have you done for your guts lately? Your gut communicates with your brain. It communicates with your brain in a millisecond. So understand that if you're going and you're having some depression, anxiety, stress, even neurodegenerative disease, to get the eclectic view, you need to look at both the gut in the brain and the communication and all the things that go on between the two. If you have any questions, feel free to reach out to me. If you're not sure who to trust, feel free, you can trust me. This information will be coming all the time. We do several Facebook Lives. We're always posting. Please follow my podcast. Feel free to, again, DM me, anything like that. I'm here for you. I'm Dr. Rob Silverman, always yours in health.